It's very interesting and exciting to learn about the PRP because this is one of the very trending treatments. People all over the world are swearing by this treatment, and some have seen incredible results in hair fall control and regrowth of hair using PRP, and it's a very interesting concept. It is known as the platelet-rich plasma. In the platelet-rich plasma, we use your own blood. It is currently the most popular, and I can say that it's a very effective therapy, and it is used globally because it saves time. You do not have to take too many sessions. In fact, you can take a session every 2 months or so, which saves a lot of your time, and it gives faster and better results, and there is a more guarantee of getting the results because we are not just reaching the target organ, but we are giving the target organ the growth factors or the stem cells, which will definitely give you better growth in your hair. So it uses the growth factor from our own body. Blood is taken out from your own body, and the growth factors from the blood are separated. So we all have growth factors. That is why when we hurt or we cut, we heal, and this principle that the growth factors are present in the body is used very smartly when we do the PRP treatment. So these growth factors are separated from your blood and injected into the target organ so that there is enhanced rejuvenation. So blood is collected from the own body. Around 20 ml of blood is collected. Once the blood is removed out of your body, the most important step is to stabilize that blood, because we all know that once blood is removed from your body, it's not going to be stable. So that is the most important and has to be done really well with some amazing quality reagents. So after the stabilization, the blood is centrifuged. So the white blood cells, the red blood cells, and the platelets which contain the growth factors. So the growth factors are separated out from it, and only the growth factor part of the blood is used. These growth factors are injected using a very tiny needle. It's an irritating but relatively pain-free procedure because we do not want to go deep into the muscle like a regular injection. We just want to make sure that it goes transdermally. So it's a very thin and tiny needle which just goes across the dermis and goes into the mesoderm, and it deposits a small drop of the growth factors in the mesoderm. Several such small droplets of the growth factors are spread all over the scalp, and when it is spread all over the scalp into the mesoderm has an abundance of growth factors. The hair roots get an abundance of growth factors with a lot of proteins and other nutrients, and that creates a phenomenal experience where you see reduction in hair fall and a lot of new growth of hair, and the new hair that grows is of a much better texture. It requires very few sessions. In fact, 3 or 4 sessions in a whole year are enough, and these sessions can be taken at 6 to 8 weeks interval. So people travel from far and wide to take PRP at their favorite center, and even if one PRP is taken in 3 months, it has been giving good results. The results are very promising because the quality of the ingredient that we are delivering to the site is very good. We are not delivering merely nutrition or vitamins and hoping that the body will convert them into growth factors. We are making sure that we are taking the growth factors and delivering them. So in a very casual way, I say that if I give you a bottle of glucose and then I expect that your body converts it into blood, then I'm expecting your body to do work which I will not be able to control completely. But if I give you a bottle of blood, then you know that your hemoglobin is definitely going to rise. So similarly, if I am separating the growth factors, I'm ensuring that the growth factors reach the hair roots, then I am quite convinced that I have definitely created that abundance of growth factors in the target organ, and I can be very sure of the results. Whether we go for just nutritional therapy, whether we go for derma rollers, hair mesotherapy, or the PRP, if you have a genetic hair loss, if you are hormonally unstable, if you have hair loss due to aging, you may require maintenance. Just because it's a very superior therapy does not mean that it does not require maintenance, but the maintenance sessions for a PRP are very few. people go for 1 session a year or 2 sessions a year and are able to maintain the good results that they have got. The results will finally depend on the health of the client, because finally we're getting the growth factors from your own body. So if your body has fewer growth factors, you will get slightly lesser results. If your body is healthy and has an abundance of growth factors, your results from the PRP will be even better. Also, we need certain stabilizers that we use for the procedure, because the most important step is that from removing the blood, to make sure that we are extracting the growth factors in an absolutely scientific and in the most effective way, which will depend on the stabilizers used. So clinic to clinic, there is a difference in the results in the PRP, which depends on the quality of the stabilizers they are using for the procedure.